Action.
Hi, I'm Derek with Bionic Pets, and I'm going to show you the casting procedure for a stifle brace today. This is Zeus. He has a partial tear in his left knee, his left stifle. He's missing his opposite leg, so don't get confused. We're not doing a prosthetic casting, we're doing a stifle brace casting. These are all the components you'll see in a casting kit, which basically are rolls of fiberglass tape, a cut strip, a stockinette, your cutter, and a pair of scissors just in case you got to get the stockinette cut, and an order form. What we're going to do today is a two-person casting. Preferred is a three-person, which someone is at the head, someone's at the butt, and then there's the casting person. So today is the two-person casting demonstration, but preferably I like to do it with three. Zeus is just a good patient, so we can do it with two. So we're going to roll this stocking all the way up the leg, and when I say all the way up, it's all the way up into the groin as high as you can go, and have the person holding the stocking kind of fish hook it up real high. I like lateral recumbent, meaning a dog on their side, because I have a lot more access to their thigh and up to the groin. You can do this standing if you want to, but for me, I think laying down is a little bit easier for the dog and easier for the casting person. What you're going to do after you put the stockinette on is this cut strip's going to go on the front side of the leg. We're going to take these casting rolls. Some say 3 inch, some say 2 inch, depending on the size of the dog. We're doing 3 rolls of 2 inch today. This is a flexible casting tape, and you can get pretty thick with it and it'll still cut off fine, so don't be afraid to use every piece of casting material you have in the box that when you receive the casting tape, or casting kit rather. So I usually like to start low and hook just proximal, just above the hock. That is a good starting point, and I can kind of grasp onto the leg, and then from there I go up. And I'm trying to keep this cut strip to the front of the leg. You can put it on the side if it's a small dog. Really, it's just there to get the cast off. All right, very good. And Zeus is a really good patient. They're not all this easy, so that's why I prefer 3 people casting most of the time. All right. So I'm going to work my way up the leg, making sure that we're thick enough to take this off and it not fall apart. So I want at least 3 layers of tape with this flexible fiberglass, but you can go 5, 6 layers thick and cut it off no problem with our clever cutter tool. All right, good job, Zeus. There you go. So we're gonna work all the way up, and you wanna go as high up into the groin as possible. I get cast back every day that are just to there, so we wanna go past the knee, all the way up into the groin. The higher, the better. That'll result in a better brace in the end. I'm gonna go with one more roll. Okay. Good job, Zeus. So I dip these rolls in the water for 3 to 5 seconds and wring them out. You want to make sure that immediately after you open them, you start to use them because they can dry out rather quickly. Sometimes you can get a defective roll that's dried out right when you open it up, so be aware, and if that's the case, we can always send you more rolls. All right, so I'm flexing the knee. I'm gonna find knee center. I'm actually gonna kind of pinch that area right there. If you're able to, and you got a nice dog like Zeus, it's very nice to be able to just kind of find knee center, and I put my fingers there, and that just gives me a little indentation to where the knee center and the joint will lie. And I'm going to kind of just rub along the fiberglass that gets it to harden and cure to itself. There you go. And I'm trying to keep the knee as straight as possible. Sometimes there's medial lateral deformities, so I don't want to be twisting the leg. I'm trying to keep it as straight as possible. There you go. And this will take 3 to 5 minutes to harden, and then I'll show you how to take it off. Good job, Zeus. And Zeus is practically falling asleep. There you go. All right. Good. getting close. And if your dog just won't lay down like this, you can do a standing cast like I said, but this is preferred for me. Every company has a different way. While we're waiting for this to dry, make sure you fill out the order form completely. Basically these two boxes, this one and this one, we usually will fill out this section. You can add the brace color there. If you have any questions, you can email us, Derrick, D-E-R-R-I-C-K @bionicpets.org, or call us at 703-474-6204. All right, that is almost done. This is a clever cutter. If you need to, you can draw a line right down the length of this cutter, this cut strip rather, but this thing will not cut your dog. It's got a safety tip to it. So this is just to kind of give a guide to put this cutter down. So we got about 30 more seconds and we're gonna cut that off. I'm gonna snag a marker. So like so, if you have a Sharpie, you can go right down. You can put some cross hatches just so I can line the cast up later. And we're ready to take that off. So you're gonna go right down. I like to start from the top, but it really doesn't matter. I'm gonna make it look harder than it should be. All right. And you're gonna go right down the ridge, like so. Sometimes it takes a couple times to get it all. And then you're gonna remove the cut strip. And you can use the scissors at this point to cut down the length of the stocking. Otherwise, you can just slide the whole cast off. Depends on the angles you used. All right. And then I can just pull this right off. And please remember to mark your cast with your dog's name and which leg it is. So that's his left leg. And that is the Bionic Pets Stifle casting procedure. Thank you very much.